Now, someone said, hey, Tabo, can you speak about the bumps that diabetics get on their stomachs, right? Now, this is a very common problem among diabetics, especially those ones who inject insulin on a daily basis, right? Now, the phenomenon is called lipohypertrophy. It's when fatty tissue under your skin kind of like creates bumps on your skin. I don't know if I have it, but like you get like black spots like this, right? And this is caused by basically injecting the same spot all the time. What you want to do when you inject is that you want to maybe I should stand up. Yeah, you want to cut your stomach into four quadrants, right? You want to cut your stomach into four quadrants, and then you inject here, you inject here, you inject here, you inject here. You want to rotate. You want to rotate your injection sites as often as possible, right? Something that you can also do to kind of avoid those lumps is changing your needle, right? So my hands are washed. Don't worry. So you would take off this old one. So you use it once, right? If they're really much of a big problem, I change mine like once a day, sometimes once a week. But yeah, if they're a problem to you, what you want to do is you want to use a new needle every time you kind of like inject yourself, right? Similarly, you might want to change your injection sites. Remember, as a diabetic, you can inject on the back of your arms, on your stomach, and on the sides of your thighs. But just remember that certain insulin is recommended on your stomach, like fast-acting insulin, because absorption is easier here than it is on like the sides of your legs. But it's yeah. But yeah, try and rotate your injection sites. Change your needle. I know something that I was taught by a diabetic teacher when I was new to diabetes is that you want to inject, right, and then you want to place two fingers, and then next time when you inject like above it, and then place two fingers, and then you can someone just change it up, and then just like that you want to rotate around your stomach for your insulin, so that in order to avoid hypertrophy. The problem with those bumps is that when you have those bumps and you inject where those bumps are, they affect the absorption of insulin. So normally if you may need like 6 units of insulin, it might take longer to start working because you injected it in that lumpy spot, right? So it affects glucose absorption, which in turn would mean that you would suffer from high glucose because your insulin isn't working as effectively or isn't being absorbed quickly enough for your body to kind of like counter those carbohydrates that you would be having. So yeah, rotate the injection sites or change your needle as often as you can. Nah? And yeah, it's called lipohypertrophy. If you want to look it up on Google, please do. But yeah, that's kind of like how to solve it. Yeah, there isn't really much of a solve for it besides changing your needles and changing injection sites. Hola, stay safe and keep those numbers. Nah.